Good morning to everyone, to Abdiel, to the sign language interpreter, and the audience who listens to us every day. Today is a very special day for Cuba due to the start of the academic year. We extend our congratulations message for all teachers, students, assistant teachers, and all families involved in this process, which comprises the whole society as such. We wanted to highlight the important role played by our professors, students, and family regarding the compliance with the safety measures in schools and classrooms, which have proved to be well organized in cooperation with the Education Ministry and health officials who were consigned to ensure the fulfillment of these regulations. Finally, I convey my congratulations and encourage you all to protect yourself from the disease, wishing you great success in this new academic year. Unfortunately, we start the day by reporting the death of an 84-year-old male patient from Havana province. We offer our condolences to his family and friends. He showed the first symptoms on August 15th and was hospitalized. He presented a rather torpid evolution, tested positive for COVID-19, and from August 24th, his clinical conditions began to worsen. As of August 26th, he developed a series of complications and was reported as critical, but unstable. He was one of the patients reported as critical over the last days. On August 31st, he went into a cardiac respiratory arrest, and despite the efforts made by our health professionals, it was not possible to revive him. Again, we extend our condolences to his family and friends. That said, today we report 1,206 hospitalized patients, 28 under medical supervision, 605 are suspected cases, and 573 are confirmed active cases. Yesterday, 4,958 samples were processed in the molecular biology laboratories of our country. Almost 5,000 samples, although the goal is to reach 6,000 or 7,000 processed samples in the upcoming days. 1,712 were processed at the Tropical Medicine Institute Pedro Coury, 800 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 635 in Havana's, 282 in Santiago de Cuba's, 510 in the Genetic Engineering and Biotechnology Lab, 408 in Hermanos Amejeiras Hospital, 200 in the Center for Molecular Immunology, 510 in the National Civil Defense Center, 118 in Manuel Fajardo's Hospital, 104 in Fructuoso Rodriguez Hospital. As a result of the analysis and processing of these 4,958 samples, 33 people tested positive for COVID-19. This brings the total amount of processed samples in our country to 403,181, of which 4,065 people, or 1.01%, have been diagnosed with COVID-19. As I always mention, samples from all the country's provinces were tested, depending on its epidemiological complexity. Pinar del Rio, 129. Havana processed the most with 3,695. Matanzas, 221. Villa Clara, 244. Ciego de Ávila, 171. Las Tunas, 80, and so forth from every Cuban territory. We would like to turn your attention to an information that shows Cuba's position in the world, considering the amount of confirmed cases. In the Americas region, Cuba occupies the 22nd position with 4,065 positive cases. Well, with the lower number of cases, we find Jamaica, Bahamas, Trinidad and Tobago, Uruguay. And above Cuba, we have Nicaragua, Haiti, Paraguay. This is the behavior of our country regarding the number of positive cases in the Americas region. The 33 positive cases are Cubans, of which 27, or the 78.8%, are confirmed case contacts, which denotes the importance of this risk group that always exceeds the 70 or 80% of all confirmed cases. Thus, Cuba accumulates 3,599 people, the 89.9% that have been confirmed case contacts. I stress, confirmed case contacts represent the most significant risk group, hence the importance of tracking down all contacts and the cooperation of these people while being hospitalized. The source of infection linked to 6 patients is yet to be determined, for a cumulative of 41 people over the last 15 days. However, our professionals keep up the hard work, given the importance it entails. Yesterday, we did not detect any imported cases, meaning that none of the patients contracted the disease abroad. Of the 33 diagnosed patients, 18 are male and 15 are female, which maintains a balance that is 50.5% and 45.5% respectively. 28 patients, that is 84.8% of all cases confirmed yesterday, were asymptomatic, a relatively high figure since it accounts for 2,372 people, the 58.4% of all confirmed cases up to date. This is a specific feature of the disease which makes it different from other communicable diseases. Therefore, unless a study is carried, we are not able to detect the disease, since the person does not present any symptoms and still transmits the virus. By age groups, 3 children or individuals in pediatric ages were diagnosed with the disease, for a total of 415 patients under the age of 18, of which 378, the 91.1%, are recovered and discharged from hospital. 13 patients are between 20 and 39 years of age, 12 patients between 40 and 60 years of age, and 5 exceed 60 years of age. As I mentioned, the 33 patients are local transmission cases. None of them is imported, of which 23 belong to Havana and 10 to Matanzas. The 10 cases from Matanzas belong 4 to Matanzas and 6 to Cárdenas municipality. However, the 4 patients from Matanzas are linked to the transmission event detected in Cárdenas. The 23 cases from Havana province belong 6 to Boyeros, 4 to Habana Vieja, 3 to La Lisa, 2 cases each to Arroyo Naranjo, Regla, and Habana del Este, 1 case each to Guanabacoa, Marianao, Playa, and Plaza de la Revolución. Therefore, Havana's confirmed rate per 100,000 inhabitants is the highest in the country, with 23.23, Artemisa's 12.82, both of them slightly lower than the previous day. In this order, Matanzas with 5.14, higher than yesterday, Pinar del Río with 4.8, lower as well, Ciego de Ávila with 2.06, Las Tunas 1.5, Villa Clara 0.77, Mayabeque 0.26, and Camagüey 0.13, both of them lower than the previous day. Hence, Cuba's rate per 100,000 inhabitants is 5.82, also lower than yesterday's rate. With this behavior, of the 4,065 diagnosed patients in Cuba, 573 are confirmed and hospitalized active cases, that is 14.1%, of which 548, or 95.6%, present a clinically stable evolution. At the beginning of the briefing, we reported the death of a patient, what brings the COVID-19 death toll in Cuba to 95. This means that the island has a mortality rate of 2.33% in opposition to the global rate of 3.45% and the regional rate of 3.49%. We always mention the 2 evacuated patients at the start of the pandemic. Yesterday, 17 patients were discharged from hospital, still a negative balance between discharged and hospitalized patients. 14 are from Havana province, 2 from Pinar del Río, and 1 from Holguín, what means that the 84% of all diagnosed cases in Cuba, or 3,695, are recovered from the virus. 6 patients are in critical state, representing a high figure, and 19 in serious conditions, which reflects the complexity of the disease in spite of the Cuban treatment protocols and proceedings applied when dealing with an infected person. One patient reported as critical passed to serious condition, and 4 other patients joined the group of those reported as serious, for a total of 19 patients. I would like to display a map of Cuba that shows all the municipalities that have reported COVID-19 cases over the last 15 days. We're talking about 38 municipalities that have reported COVID-19 cases, such as 15 municipalities from Havana province, 2 from Matanzas, 2 from Pinar del Río, 9 from Artemisa, 1 from Las Tunas, 3 from Villa Clara, 2 from Ciego de Ávila, 1 each from the provinces of Mayabeque and Camagüey. We have presented also all the municipalities that have reported even only 1 case over the last 15 days. The staff from the monitoring center also gathered information regarding the municipalities with higher incidence rates in the last 15 days, what resulted in 19 municipalities that comprises the 15 municipalities from Havana province. And the distribution regarding the amount of positive cases in the last 15 days, what evidences the great spread of the disease in the capital, which is why a new set of measures are being applied from today on. In Pinar del Río, the municipality with higher incidence is La Palma, in Matanzas, Cárdenas, and in Artemisa, the municipalities of Mariel and San Cristóbal. Concerning worldwide statistics, as of yesterday, COVID-19 continues to be present in the same 185 countries. 222,622 people were diagnosed yesterday, for a cumulative of 25,252,030 infections. 3,690 deaths were reported yesterday, which amounts 846,848 fatalities, and a mortality rate of 3.35%. The region of the Americas, the epicenter of the pandemic, reports 89,011 new cases, for a total of 13,396,652 infections, which accounts for 53.05% of worldwide diagnosed cases. 1,761 people died yesterday. Thus, the region accumulates 467,767 fatalities and a mortality rate of 3.49%. In our region, the United States reports 5,997,163 infections up to yesterday. However, the latest information confirms 6 million infections already and more than 183,000 deaths. Brazil follows with 3,862,301 diagnosed cases and 120,828 fatalities. India comes next with 3,621,245 infections and 64,469 fatalities. On the other hand, Peru has reported a high figure of diagnosed cases, 7,731, and 181 deaths only yesterday. Colombia with 8,024 infections and 300 deaths yesterday, and Mexico with 595,841 COVID-19 cases and 339 fatalities in one day. In this order, these are the countries hardest hit by the pandemic. This is all the information on the behavior of the pandemic in Cuba and the world.